Executive Director of Mind Medicine Australia, and I'm here with Dr. Stephen Proud, psychiatrist and member, Board Director of Mind Medicine Australia, and also on the faculty of our Certificate in Psychedelic-Assisted Therapies. And here with the wonderful Sydney from Locum Life. And Sydney, would you just like to give a little welcome and talk about what you do so that everyone can learn about that?
Yeah, absolutely. Thank you, Tania. So hi, everyone. For those of you who don't know me, my name is Sydney, and I'm the manager of the mental health department here at Locum Life. So myself and my team specialise in placing psychiatrists into locum roles across the country. And yeah, we're just really proud to collaborate with the guys at Mind Medicine Australia. Like, I've personally been following these guys for a while now, and I'm always really interested to see and hear about their advances in the psychedelic-assisted therapy space. And I just think together, you know, we're connecting some of Australia's top psychiatrists and clinicians with opportunities to expand their clinical knowledge, you know, explore these therapies and just deliver better care to communities nationwide. So with that in mind, if anyone attending tonight is interested in locum work across a broad spectrum of specialities, not just psychiatry, please get in touch with myself after the webinar. We're currently offering a $1,000 sign-up bonus for anyone who hasn't worked with us before, and also a $1,000 referral bonus if you refer a colleague. So yeah, get in touch. I'll leave my contact details in the chat. But for now, I'll just hand you back over to the guys at Mind Medicine.
Yeah. And Steve, do you want to just say a quick welcome from you as well?
Hi, welcome everybody. I'm Dr. Steve Proud. I'm a psychiatrist in rural Western Australia, Busselton. I'm an authorised psychiatrist prescribing psychedelics, and I'm currently helping run the residential component of this psychedelic certificate run by Mind Medicine Australia. So I'm here in Sydney, away from my normal home. I did the certificate a couple of years ago. I had access to world experts. It was very varied, incredibly rich, but the highlight for me was always the residential retreat. And after I graduated, I had lots and lots of support from Mind Medicine Australia, technical support as well, in developing the protocols to set up my own clinic. And everything that I've learned, I'm now feeding back into Mind Medicine Australia to assist psychiatrists, psychologists, psychotherapists, and the wide range of people that are currently studying this certificate. Nurses, GPs, psychotherapists, OT, social workers, the whole range. It's been a very rich experience. It's a rich journey, and the psychedelics, if you use them correctly, have fantastic therapeutic potential.
Thank you so much, Steve. And Alan, do you want to just explain a little bit, just very briefly, about your role and the consulting work and the clinic and so on?
Sure. So, hello. So my name is Ilan Heyman, and I'm the operations manager at MMA Mind Medicine Australia. I mainly look after the commercial side of the rollout of psychedelic-assisted therapies. So together we import medicine and sell that to psychiatrists. We're also now looking at clinic rollouts, and as part of that work, as Dr. Proud said, we are assisting psychiatrists who want to become authorized prescribers by helping them compose their HREC submissions and then helping them through the TGA permit process as well. And Tania will have a slide on that at the end of the evening. And I'll put a link in the chat as well for those of you who then want to reach out to us to contact us and find out more.
And we'll also talk about our Mind Medicine Australia clinic during this presentation. So before I go on, I just really would like to acknowledge the wonderful healers and light keepers and wisdom keepers who have really been there all along the way with these ancient medicines, these ancient plant medicines originally. And acknowledge all the people whose shoulders we stand on, because if it weren't for them, we wouldn't even know that these sacred substances existed to heal people who are suffering and generally to raise consciousness in humanity. So we want to acknowledge them. So we're going to start off with, the other thing I would like to really invite you to do is if you've got questions, put them in the chat. Ilan will be replying in the chat, and we'll also have the opportunity to unmute your mics and have a conversation. So we're going to go through this presentation fairly quickly, and then we'll come to your questions and then hopefully have a really interesting and rich discussion. So this is what we'll be covering today, these headings, and we'll go through them step by step. So to begin with, of course, the reason that we're here is because 1 in 4 Australians have a mental illness right now, and an expected 1 in 2 of us will suffer a serious mental illness in our lifetimes. 1 in 6 Australians are now on antidepressants, 1 in 30 children being prescribed psychiatric medications, and 1 in 4 people aged 55 and over on psychiatric medications. So we're literally numbing and dumbing out a large part of our population with medicines that don't necessarily suit the majority, and we'll show you some statistics on that shortly. The cost of that is enormous suffering to human life and the potential of people to live a life of happiness and health. And of course, the cost to the community is enormous. And despite the best efforts of extraordinary clinicians like all of you, the situation's getting worse. And unfortunately, in certain parts of the population, the situation is even worse. So we have veterans and first responders and other professions and sectors of industry, for example, even doctors and lawyers and farmers, who have a much higher incidence of mental illness and suicidality than the rest of the population. It really is tragic to see that. And we're doing everything that we can to support those sorts of cohorts, especially veterans and first responders who do so much to support our nation. And people with mental illness are more likely to be unemployed, they're more likely to be homeless, they're more likely, tragically, to take their own lives. And the cost to the community is, at the last count, and this was quite a few years ago, 220 billion. I expect that has risen enormously, and we're waiting for the next update on that. But effectively, there's been no improvement in treatment outcomes for over 50 years. And in the case of depression, only 30% of sufferers experience remission from either a mix of antidepressants and or psychotherapy, but half of those are placebo. And as many of you will know, the relapse rates are high and side effects are significant. And in the case of post-traumatic stress disorder, only about 5 to 10% of patients go into remission from that debilitating condition. So more of the same is not going to solve the problem. So we set up Mind Medicine Australia as a charity back in 2019, and that followed my husband Peter and my experiences in Europe with these medicines. And we'd never taken any drugs in our life, and we had these profound life-changing experiences with these medicines in 2016, to the extent that we then met a lot of the leading researchers and clinicians around the world and attended a lot of the conferences and events around the world to learn more about this, because we're social entrepreneurs and philanthropists who believe that, you know, we'd like to, as much as possible, alleviate suffering. We can only do that as a community. No individual can do that on their own. But we knew that if we had experienced so much healing from these medicines, that people who were suffering intensely could heal enormously if they had access to these treatments. So we set about trying to see what we could do in Australia. And in fact, in the last 6 years, we've achieved an enormous amount, more than what we expected. And that's due to the support of an extraordinary board and advisory panel, and ambassadors, and the Australian community at large, who, you know, no one wants to see their family and workmates and others suffering as they are. So our focus has been on setting up a national ecosystem to expand the treatments available to clinicians, to give all of you more tools in your toolbox to ease this suffering. And we also focus on supplying medicines, as Ilan mentioned, clinical rollouts as well, and lots of regulatory and research advancements. And of course, we made history in 2023 through the successful rescheduling applications we made to the TGA and became the first nation in the world to reschedule psilocybin MDMA. Bless you, Stephen. And so for us, success means that these therapies will become an integral part of our mental health system so that they can be a first-line treatment where all of you as clinicians can talk about these therapies, can offer them to your clients with full explanation of the risks and benefits of these treatments and all other treatments, and proper informed consent before any patient obviously goes through these treatments. And it's important to note that these treatments have been achieving remission rates of 60 to 80% around the world in hundreds of trials, research and development that's taking place globally. And that is significantly higher than the remission rates that I just mentioned before. So many, many more people could get well. And as a charity, our goal is that these treatments are accessible and affordable to all Australians in need. So it's particularly important that people like Stephen in Busselton and people in regional and rural Australia have access to these treatments, and that these treatments are not just for the rich, that they're for everybody. And we'll talk about some of the ways that we're making these treatments accessible and as affordable as possible to those who need these treatments. So our focus at the moment is on medicinal psilocybin for depression and potentially obsessive compulsive disorder, eating disorders, and also addictions, and then medicinal MDMA for post-traumatic stress disorder and also addictions. But there's many more conditions that are currently being researched with both these medicines, and ketamine is also being used quite a lot more around Australia now, and it is another psychedelic medicine. The remarkable thing about these treatments is they only require 2 to 3 medicine sessions in combination with a short course of psychotherapy. And that's compared to, in many cases, a lifetime of psychiatric medications, often multiple ones, and ongoing therapy for the course of a patient's life, often or for decades. So these are curative medicines. They're not just managing the condition, and they're considered extremely safe in medically controlled environments and non-addictive. And Stephen will talk more to that, I'm sure. And both medicines have been granted breakthrough therapy designation by the FDA in the US, which is only granted to medicines that could be vastly superior to existing treatments. Now, Steve, I was thinking that you might like to talk a little bit about how the medicines are administered and why this is so important, this particular process.
All right. So we are very careful in using these medicines. They are very powerful, but we need to be skilled and cautious clinicians. So when a patient is referred, there's an extensive screening process that includes a physical health check, liaison with their GPs and any medical specialists, a thorough psychiatric assessment, and also a psychological assessment. If they pass all these assessments in conjunction with their next of kin or support person who comes along and they've been given all the information and all the answers to their questions, then we consider them suitable for psychedelic therapy. We choose the appropriate medication, we choose a starting date, and then the patient is allocated to their 2 therapists. So this is different to standard treatment. Treatment involves 2 highly trained and skilled psychedelic therapists who have at least 3 sessions with the patients before they attend for their first dose. Many of my patients, I insist that before they even start this journey, they become embedded with the lead therapist. So they often have a previous 5 or 10 sessions, and this is optional, but that's an extra layer of safety. Then on the dosing day, they come with their support person. The authorised psychiatrist and the therapist do a check-in, make sure that everything's okay to proceed. Then the psychiatrist gets the medicine and gives it directly to the patient, and that is recorded. And then the two therapists sit with the patient throughout the session, which typically lasts around 6 to 8 hours for both psilocybin and MDMA. At the end of the session, as the intensity is wearing off, the therapist and the patient process the experience, and that patient is not allowed to leave the dosing room until they are stable, and they leave in the company of their support person. And the following morning, there's a further intensive integration session with the patient and both of the therapists. And once that person is safe and stable, they are then discharged home with their support person, and the follow-up integration session with the two therapists is booked. And there's usually a minimum of 3 integration sessions, but it can often be more because they don't finish until clinical stability has been achieved. Then if we're going to go on to a second or third dose, and most protocols will use 2 or 3 doses, then you go through the process again. You prepare for the next dosing session, you have the dosing session, you integrate it again, and then you decide whether a third session is required or not. And at the end of the process, when everything is stable, we liaise with their community treatment team, whether it's a psychiatrist, psychologist, GP, other mental health specialists, to make a safe and seamless transition back into the community. So I've done a number of these, and as long as you carefully select the patients, so some patients are a no-no, patients who suffer from schizophrenia or with dementia are obviously not suited. If you carefully select them, carefully screen them, and carefully work them up with 2 highly skilled therapists, and then very carefully process the experience, there are very few negative outcomes. Not to say that there aren't very challenging experiences, and not to say that there can't be negative outcomes, but I've yet to have one. But let's be realistic. There can be negative outcomes, and there can be highly challenging experiences that require a lot of expertise. That probably gives an overview.
Thanks, Steve. That's very helpful. And it's important to say that, the reason why all of this needs to take place is that these medicines take patients into an altered state of consciousness. And psilocybin in particular takes a patient into a whole other multidimensional world. And MDMA takes them into a loving space. And we'll talk more about that shortly in this presentation. But these experiences are often named by patients as one of the top 5 or even top 2 life experiences that the patients has had. And whoever says that about a medicine normally. And this is because patients have an experience of oneness and connection to self, others, and the planet that is extremely unusual, especially for patients who are suffering with a mental illness where they feel quite isolated and disconnected and separate. So these medicines give them that sense of connection to everything and being part of everything. And it's with that in mind that these integration sessions can be profoundly helpful, because skilled therapists such as Stephen and many of you who may be interested in studying the certificate in psychedelic-assisted therapies and working in this field can then work with the patients where there is a much more flexible brain in place, so that the patient is more open to making the changes that they need to make in their lives or relationships, accommodation, whatever it may be that needs to change their habits so that they can actually start to move forwards with their lives and live in the present instead of continually bringing the past into the present. So we'll talk further about that, but it's an extraordinary experience, and some people do rate these experiences on par with the birth of their first child or their wedding day. So you can see here the 2 therapists that Stephen has spoken about, and usually it is male and female dyad. The patient there is undergoing the experience with an eye mask on and headphones, because this is a very interior type of journey. It's really about the patient going inwards and being able to travel inside themselves and their psyche, I guess you'd call it, Stephen, and and to be able to go inwards without having external stimuli, which is what distracts us so much in this world that we're living in right now. And you can see here this extraordinary safety record, with thousands of patients that have gone through trials. There's been no serious adverse events, and over 160 patients in Australia have been treated so far with no serious adverse events recorded. And one of the things that keeps us going at Mind Medicine Australia, because I have to say this has not been an easy journey, but we've seen some extraordinary outcomes. We receive extraordinary outcomes from clinicians who are just so thrilled and inspired to have more tools in their toolbox. But of course, it's the patients that we're all here to support. And you can see here, for example, a veteran who said 1 week of intensive treatment provided transformational healing. Another one said, wars would be impossible to wage. Another one said, I felt like I went through 15 years of psychological therapy in one night. And MDMA is the reason my son has a father instead of a folded flag. Really, really profound experiences. And we hear about this all the time. And the other thing that's important to note is that the usual effect size for an antidepressant for depression is about 0.3 on the Cohen's d scale. Whereas you can see the effect size of psilocybin and MDMA, which range from about 7 to 10 times more effective. And this is what's going on. So what's happening with psilocybin is you get this altered communication between brain networks and a bypassing of what's called the default mode network of our brain, which is what keeps us often stuck in childhood programs and traumas that we've had, and that we keep on going back to. So we become very rigid and stuck in our thinking. You can see that on the right-hand circle. So and that's a representation of an MRI scan of a brain showing very limited neural connectivity, ruminating, stuck thought loops, I'm not good enough, things will never work out to me, no one loves me, etc., etc. And we hear that from patients all the time, that they feel like their life is not worth living. Yet with the ingestion of the psilocybin, you see this massive neurogenesis occurring, this reconnection of neural pathways. By the way, there's just as many lines and dots in both diagrams as just one is a really incredibly awake and connected brain. And it's with that flexibility, which occurs for a few weeks after each medicine treatment, that these wonderfully skilled therapists like all of you can work with the patient and enable the patient to move forward with their lives. And also the patients really develop a sense of empowerment in their own healing journey. So instead of taking a daily tablet or having to go to therapy every week to stay afloat and functional, this is the patient's opportunity to actually become their own healer with the support of wonderful therapists. And the other remarkable thing is, as well, is the outstanding trial results. So with current treatments, as you will all know, if a patient hits a particular plateau, say with an antidepressant or other psychiatric medication, then often, and Stephen will attest to this, you might have to change the dosage, try a different medication, and it's often unknown which medication is going to work. Whereas in the case of these treatments, the remission rates increase over time because of the integration process that Stephen spoke about before. Stephen, do you want to comment any further on that remission process and how that continues to really help patients improve over time rather than being such a short-term fix?
With that, integration is not just an affair between the patient and their two therapists.
Yes.
Often their family support system is brought in.
Yes.
The patients work out their goals for a healthier lifestyle going forward. They make changes in direction. I have one patient that has started to go to a women's group and to a yoga and sound healing group where she'd been previously isolated at home with the family. So those extra social connections, which when you're very depressed or even partially depressed because you've had a partial response to your antidepressant. You don't seem to have the urge to go out and do, but after you've had a catharsis and integrated it, and you then develop good habits with these new life skills, people seem to do a lot better over time. And also the experience itself just goes on in the subconscious for quite a while. And you
I've
don't
never
see
forgotten
the-
my first experience, never.
Yeah.
Yes. Okay, that's very helpful. Thank you. And I'm just going to just mention a couple of research trial results just to give you all a sense of what has been taking place. And there was a comparison study that took place between 2 doses of psilocybin versus patients who were taking, so one group was taking 2 doses of psilocybin and the other group was taking a daily dose of escitalopram, a leading SSRI. And at the end of the trial, and each of the groups had the same amount of psychotherapy alongside the medicines. The remission rates were twice as high in the psilocybin group versus the antidepressant group, and the quicker effects of psilocybin, plus far less side effects, suicidality, and so on. There's other trials as well, and I'm not going to go through them all because there's so many trials going on at the moment around the world. But I will also now talk about the MDMA trials, and just about MDMA for a moment. Just talking about the fact that it's very important to say that MDMA is not ecstasy. We're talking about pure pharmaceutical grade MDMA, which creates this very important empathetic bond between therapist and client and decreases fear, defensiveness, increases empathy, trust, and safety, reduces the activity of the amygdala, the fight, flight, freeze response, and just creates a wonderful warmth and safety so that patients don't get re-triggered and re-traumatized when talking about their trauma and are actually able to talk about their trauma in a safe and accepting space. Doesn't mean they forget about it, but it does mean that they can move forwards with their lives without continuously being triggered by the trauma. And in the very well-known MAPS phase 3 trial results, 71.2% of participants in the MDMA group after just 3 doses of MDMA with psychotherapy no longer met the criteria for PTSD, and 86.2% of the participants noted improved outcomes. So very significant results. And well, now so when we started Mind Medicine Australia 6 years ago, there was one trial going on in Australia, and now there's all of these, and Australia and New Zealand, and these. And so we can see this massively and rapidly emerging field coming through, and which all of you have a chance to be part of and to contribute your wonderful therapeutic talents to. And we can see here again, the federal government committed $15 million to support 7 trials in Australia with psychedelic-assisted therapies, and this was through the work we did with the Morrison government. And then, of course, this world-first achievement of the rescheduling of psilocybin and MDMA in February 2023. And this year now we've put another submission with Endwise to consider the expansion of psilocybin for the treatment of end-of-life distress and anxiety combined with terminal diagnoses. And there's been a lot of research to suggest that psilocybin for end of life is an extraordinarily positive intervention, giving patients the chance to really live out the rest of their lives without being stressed by the diagnosis that might have. Other countries are running to try and keep up with Australia, but they can't keep up at the moment. But you can see there's expanded access schemes taking place in various places in the US and Europe, Israel, and so on, the Czech government as well now. And there's also trials underway for a whole range of conditions like eating disorders, obsessive compulsive disorder I mentioned before, weight loss, Parkinson's, schizophrenia, autism spectrum disorder, fibromyalgia, cluster headaches, irritable bowel syndrome. And there's recently been some studies that suggest that psilocybin is also very positive for anti-aging. And in fact, a lot of the psilocybin pioneers have lived notably long lives. So where are we today in Australia? So this was our rescheduling process. So we got knocked back 3 times before the TGA finally gave the all clear for these medicines to be rescheduled. and over 13,500 Australians made supporting submissions for that rescheduling. And at the end of the day, it was impossible to ignore the suffering that's occurring in Australia with lack of current treatments being very effective. So that was an extraordinary outcome, which led to these global headlines. There was hundreds of headlines around the world about Australia leading the world, and could other countries do the same, and so on. We're approached all the time by international organisations and governments who would like to emulate what Australia is doing. So today, as we speak, over 160 patients have been treated in Australia. That might not sound like much, but it's growing all the time. There's an exponential increase in authorised prescribers as well, about 40 at the moment around Australia, but many more in the pipeline. And we've trained over 100 psychiatrists so far, as well as 500 psychologists, psychotherapists, social workers, mental health nurses, occupational therapists, and other doctors, specialists, and so on. So the numbers are growing all the time, and the numbers of therapists working in psychedelic-assisted therapies are growing all the time. There's a number of clinics which will show you where they're located in a moment. And we've started a Mind Medicine Australia Patient Support Fund, which supports patients who otherwise couldn't afford the upfront costs of these treatments. And they're patients who demonstrably are extremely disadvantaged. They may be veterans, first responders, or others who suffered seriously, and we pay up to 50% of the upfront costs for those patients. Medibank has also announced funding for eligible customers, and other payers are also getting involved, including NDIS, Department of Veterans Affairs, WorkCover, and others as well. We've also funded a national registry at Australian National University to collate real-world evidence from psychiatrists like Stephen and other authorised prescribers around Australia. And there's nothing more important than collating real-world evidence, because that really shows the government what is occurring. And, you know, as Stephen says, he's had so far very positive outcomes, and so have all the other psychiatrists that we know. But it's also important to collate, you know, adverse outcomes as well, and to just be really on top of the data and science that is occurring in the field. There's also a number of other trials in Australia, which I showed you before, and we have a partnership with a Canadian pharmaceutical company which supplies medicines at a very reasonable cost. So you won't find medicines any cheaper than the medicines that we supply, and they're very, very high quality medicines. You can see here now the map of Australia with clinics in black that are already in existence. You can see Stephen's one there down in Busselton, which is probably one of the most, more remote regional areas where this therapy is taking place, thanks to you, Steve. And others in blue that are forming now, and we'd be delighted to help any of you set up clinics as well in wherever you're located. We look forward to meeting you very shortly. Do put in the chat where you're from and what clinic you're associated with. So this is a trial that, no, not a trial, some results that took place at Amiria in Perth, PAC Centre, and they were using MDMA, and 63% of patients no longer met the criteria for PTSD after their treatment and 6 months later, which is extraordinary. And one of the patients we heard about from one of the psychiatrists there had been unable to leave her house for 20 years. She couldn't catch a bus, didn't go to the local shops, didn't do anything like that. But after she had this treatment, she went to the local shops on the local bus, and she's been able to do that ever since. And so this is all about giving people their lives back and giving hope to people who've tried many, many other treatments as well. And this one from Monarch Mental Health, you can see here 10 patients with MDMA therapy again, full remission maintained at the 6-month follow-up. And you can see these depression, anxiety, and stress scores really going down through these treatments. So here's some of the payors again, and hopefully more and more health insurers will come on board as well. And the for-profit sector will be incredibly important, and is, of course, jumping on the bandwagon wherever they see a dollar sign. But we believe it's very important that the for-profit sector is involved so that these treatments can be scaled and that they can reach the millions of people who are suffering with these conditions. So this market is estimated at 16 trillion by 2030. You can see that there again. Huge amount of psychedelic drug sales there as well. Not that I suggest you all go out and buy psychedelic stocks yet. They are very speculative. Mind Medicine Australia, well, these are some of our achievements. We've spoken about most of them, I think, now. And we are the largest importer of these medicines. We've launched a clinic, a Mind Medicine Australia clinic in Abbotsford in Melbourne, and it has 7 outpatient dosing rooms. It also has the ability to conduct trials there, and Stephen's a principal investigator on a trial there as well. We provide clinical consulting support. We have a global webinar series, wonderful free webinars every month with some of the leading researchers and clinicians in the world. And we also have trained over 600 clinicians with a world-leading faculty. I'll show you that in a moment. We're supporting research, development, and so on. How you can help? Well, please, ask us any questions in this conversation, but also talk to your colleagues, your medical colleagues, your allied health colleagues about this field. We all need to remove the stigma and taboo that has been attached to these medicines for far too long. These are ancient medicines, as I say, that have been with us since the beginning of human civilization. Attend our events, do our training. Many clinicians actually name us as their charity of choice and raise money for us at team lunches or special events and events they host in their communities and so on as well. And we've experienced enormous generosity from the clinical community. And I'll just quickly, so if anyone does feel like making donations, we really encourage that. And they're fully tax deductible as we're a charity, and they go towards supporting some clinicians who can't afford the training from regional and rural areas, like nurses and others who may not be able to afford the training. And we help subsidize training. We help support trials. And of course, we help patients as much as we can through our patient support fund, which you can see here. Our certificate in psychedelic-assisted therapies is considered the leading course in the world. And it is for all of, bottom left, you can see the breakout box for all of these different medical clinicians and practitioners. And we really look forward to welcoming you to study with us. The next intakes start in February and then next July as well. And the February one is more than half full already. So if you want to be in the February one, please reach out to us as soon as you can. And also for July, because every single one of our intakes sells out with a waiting list. And you can see this extraordinary faculty, which includes people like Bessel van der Kolk, Gabor Mate, Rick Doblin, David Nutt, and many, many other extraordinary practitioners from around the world. And yes, you can see some more of the faculty here as well. It's really a wonderful faculty, and we're very fortunate to have all these people supporting this work and wanting to educate clinicians. And we also have a short 6-week online course called Fundamentals of Psychedelic-Assisted Therapies. But for all of you who are clinicians, I'd recommend the certificate. It's 4 months part-time, and it's just on Sundays, 3-hour session, which you can watch live or you can watch the recording. There's assessments, and there's also professional development sessions that you can take, that you can participate in, but it's really not a huge commitment. It works very well alongside your professional work and families and so on. And then there's a 1-week intensive or 6-day intensive, as Stephen mentioned before, which is like the highlight, where all the different disciplines come together. And holotropic breath work is the altered state of consciousness that is used in our intensives. So this is some of our upcoming events, and I think we'll stop the share there and we will go to the full group. Hello, everybody, and welcome your questions. Ilan, if you'd like to, or Steve would like to draw out any of the questions that we have in the chat so far, that would be wonderful, or Nicole. And also if people at some stage, if you want to put your hand up too and ask a question, we're more than happy to also talk with you live and be humans and not just looking at each other's 2-dimensional faces. So yes, Stephen, do you want to draw any questions out? Oh, Ilan, sorry.
Sorry, Tania. So there was a
Yeah.
question during the session, which is for Stephen, and that was about other conditions like narcissism and sociopaths. Are they excluded from?
I would love to exclude them. Look, it's probably easier to spot a narcissist. It's harder to spot a sociopath unless you've got really good longitudinal history. But the person who asked the question, I think, does group retreat work. In the individual setting with two psychologists and two therapists who are doing the therapy and with the psychiatrist, the bad elements of a sociopath are less likely to arise, but they can certainly arise in a group setting. But I don't do group retreats because that's underground work currently. But any advice in the group setting is not just to try and manage it yourself. Make sure that the group supports you in setting boundaries with these types of people. Ilan, there was another question in the chat.
There was one about something following on from that, but what are the contraindications for treatment?
Stephen spoke about that with the schizophrenia, but also bipolar, borderline personality disorder, psychotic conditions, right, Steve?
Yeah, look, extreme conditions, you have absolute exclusions and then you have provisional exclusions. So absolute exclusions are dementia, probably severe level 3 autism, schizophrenia, or active suicidality or active drug and alcohol use that they're unwilling to stop. And then there's a lot of other conditions in between, or being pregnant or not willing to take contraception during the period. A lot of the others are provisional. So this is a difference between clinical trials. Clinical trials exclude many people, but when you're faced as a clinician operating in a clinic, you'll have more nuanced clinical decisions to make. But some of those big ones, schizophrenia, dementia, severe suicidality, don't
Steve,
do them.
You administered this treatment to an 8-year-old last week. So it's very interesting that you might like to talk to the age.
Yes. Well, as an aged person myself, I would be excluded from the clinical trials. But for some reason, I've been getting all the aged people where I work come to me because they've been living with these conditions, in one case for 80 years. And this person had never used psychedelics. And I was really nervous about giving them 25 milligrams of psilocybin. But she had done the work, and her therapist, who she'd been working with for 3 years, said she can do it. Then I threw in my therapist that I do a lot of work with, and that therapist, who was the co-therapist, came back and said, yep, she can do it. So I calmed down my nerves. I gave her the 25 milligrams and she had an amazing experience. So age is not an absolute contraindication. Now, of course, as you get older, most people have an abnormal ECG. So I wasn't game enough to give her MDMA because she had trauma and depression, but psilocybin is a lot safer for physically compromised people.
Thank you. Thank you, Stephen. That's fantastic. By the way, if any of you are there and want to put your cameras on, we'd love to say hi and see your faces. So, I mean, many of you are there, and hi to all of you. I'll answer this question just about the cost for patients. So, at a clinic in Melbourne, Ilan, correct me if I'm wrong, but I think one dose is about 8,000 and up to 3 doses about 25,000, including all of the therapy and preparation and everything. Is that correct?
That's right.
And so usually how that works business-wise is usually there's some kind of margin in there for your own, obviously there's clinical time, but there's also margin for your clinic within that, because the question was, how does it work business-wise? And it can be a very good business proposition, and we can consult to you and advise you exactly how you can make a profitable business out of this.
Tania, also to mention, DVA is going to fund people
Absolutely.
now.
Yeah. DVA have now got item numbers and so on. NDIS are also funding quite a few treatments. So there's
Medibank is covering 100% of treatment if you've got cover.
yes, that's right, Medibank. 300 patients, is it, Alan?
No, it's now open to all of their mental health patients who've got cover.
Right, okay, that's excellent. Steve,
Can
yeah.
I talk to Steve, Tanya?
Yes, my dear.
So
Steve
look,
was one of the first graduates of our CPAP course.
Yeah,
yeah,
exactly.
look. Hi, Steve. Good to see you online. Now, look, Steve is a very experienced, highly trained person who's looking for a clinic. There is the opportunity for people that have done the training and have got the skills and the experience to bring their own patients, for example, to my clinic, where they can dose at my clinic and you know, set up with one of my other therapists. And I hope that the other clinics around Australia will give these people who have done a lot of training the opportunity to work in those clinics.
Where are you based, Steve? Just remind me.
Well, I'm in Busselton.
No, I know where you are. Sorry, the other
Sorry,
Steve.
Steve Stutton.
Oh, Steve is in Sydney, I think.
Steve, you're in Sydney? Yes, I mean, Steve, also, if you wanted to come down to Melbourne and do a little bit of work at our MMA clinic, you know, to get some experience, that might be a possibility. So could you speak to Alan about that?
Yeah, I have some family in Melbourne I could
Stay
stay
with?
with for a while.
Yeah.
Yeah.
That would be great. So you speak to Alan about that and maybe we can work that out for you.
Okay, cool.
Yeah. Alan, would you make a note of that?
I have.
Wonderful.
Steve, I'll email you. And also, I've now allowed participants to unmute themselves. So by all means, put up your hand and ask a question.
But don't all talk at once.
No.
Emma Laird. Emma, hi, where are you? Emma's doing a very interesting trial. Emma's the person who's doing this tinnitus, wants to do this tinnitus trial with MDMA therapy, Steve, at our clinic, and maybe coming up for a psychologist. Oh, hang on, sorry. No, what? Oh,
Was wondering where Emma was based too.
she's based in Melbourne.
She's in her pajamas, so she doesn't want
Oh,
the camera
okay.
on.
I'll be looking for people to work on it. Oh, well, actually, there you go, Steve. She's also suggesting that you might want to work on her tinnitus trial.
Yes, I saw that. Yeah.
Yeah.
I asked her where she was based, but I didn't hear back yet. But you're saying
She's based in Melbourne. She's at La Trobe University.
Oh, okay.
Yeah. Okay.
There's a question from Sammy Lee. Yes, Sammy, it's only for people 18 and up. It's only for adults.
Yeah, though there is some research taking place now for eating disorders, for psilocybin for treatment of eating disorders with some slightly younger people than 18 in some places. And we'll be having a webinar next year with one of the leading eating disorder researchers who's based at University of California, San Francisco, talking about her work with eating disorders. Jonathan O'Donnell from New Zealand. There you are. Hi, Jonathan.
Hello.
How are you?
Good. It's late here.
Yes,
It's time after this.
I mean, we've had a lot of New Zealanders do our training. So are you a psychologist or psychiatrist or?
I'm a GP fellow and stage 3 psychiatry registrar.
Oh, excellent.
Yeah.
Well, I mean, we'd certainly welcome you to do the training. And New Zealand has recently made some progress. Alan, there was that great
Yeah, so the
conversation.
first psychiatrist has got his approval from a TGA equivalent regulator. I can't remember the name of it, but it's very different to here.
Yeah.
And I believe that there's one or two other permits in the pipeline. But definitely New Zealand has got a history of following the Australian TGA. So I can tell you now that this particular CPAT cohort, we actually have got quite a large contingent of practitioners from New Zealand joining.
Oh, cool.
Because they
Yeah, and
know
we've had
what's
heaps
coming.
of New Zealand psychiatrists
Yeah.
join and other doctors and nurses, mental health nurses and all sorts.
Awesome.
And
So bring your whole team and then you can set up the first really big clinic or just
New Zealand, yeah.
yeah, we'll
And
help
I
you.
do know that from a medicine point of view, so the manufacturer who we purchase from is also now looking at supplying New Zealand because there's demand coming from there. So something's brewing. So get on the bandwagon, Jonathan.
Yeah,
Cool.
definitely.
Thank you.
And Livana, who's Livana? Let me see Livana. Livana, there. Levana, tell us a bit more about the course. Tell me what you'd like to know, Levana, and we can definitely tell you more about the course. Or if anyone's got any questions about the course, just so you understand, I think the cost of the course to learn is, what is it, around $10,000, something like that?
Yes, but scholarships are available, and I put that in the chat. I've also just put the link to the course website again in the chat. We have tried to make the website as descriptive as possible, so everything's there, including the course curriculum. So the course is 120 hours. It's fully certified by the Australian Medical Standards for CPD points, which is phenomenal. In fact, it's the first course of its kind to have that certification, which means that our course was actually peer reviewed externally and approved, which is phenomenal. As of December, we are going to have over 600 people who have finished our course. And Nicole has actually just reminded me that for those of you attending tonight, and I'll also email this out
yes,
tomorrow.
there's a special offer, isn't there?
Yeah. So to normally we charge a $250 application fee just to help our team process CPAT applications
And do all the interviews, etc.
for those of you who sign up through Locum Life. So there's a special coupon code which I'll put in the chat, and it's simply apply, the word apply. So that will then deduct $200 off the that will deduct $200 off the application fee. So that's a saving right there. And you'll also get free access to the fundamental course, which is value of $600 as well. So it's really phenomenal.
Yeah, it is very phenomenal. Let's see if anyone wants to raise their hand and ask a question before we finish up. We've still got about another 5 minutes left. So if anyone wants to say anything, comment, question, anything at all, then please tell us now. It's a great opportunity to speak. Sydney, did you have any questions yourself?
No questions from me specifically. I just, want to kind of reiterate what I mentioned at the start of the chat, really. Just I'm always interested to hear what you guys are up to. I think it's phenomenal, the whole movement. It's very, very interesting. So yeah, definitely keen to continue following along.
Okay, terrific. Thank you, Sydney. I now see Luvina saying, Ilan, you might like to comment on this. I can see 78 hours face-to-face. How is this structured per week?
Yeah, I've just replied to that. So Steve can actually respond to that. But in terms of the Zoom sessions, so they're normally held on a Sunday morning between 9 to 12.
Or sometimes an evening if
Sunday
we've
evening,
got
depending on the
European
presenters'
presenters.
hours.
Yeah.
And then Steve, how much external study is needed to supplement the online sessions?
Oh, external study. You mean reading material?
So, yes, correct. So the reading material, and also there's a weekly quiz as well.
Yeah, there's an extensive reading list. So if you wanted to get the best out of the course, there's usually 6 journal articles that are germane to each topic.
Yeah.
And that's probably an extra 2 to 3 hours reading. And then there's a short quiz that only takes about 20 minutes. And then at the end of the course, there's an experiential residential, which goes for 5.5 days. So everyone that's been on the course gets to meet each other, and there's a deep bonding and learning that occurs. I'm in the middle of it at the moment. It's fantastic. And often people that have completed the course maintain contact with each other. And it's like,
yes, and many of the practitioners end up forming, clinical groups who end up working together as a result of meeting through the training. So it's remarkable how many people who've done our training have now got supervision in this area or jobs in this area. It's really starting to take off in that respect. There's a question here about what is the average cost to patients of this treatment. Well, as I said before, it depends on how many medicine doses there are, because that's where the real cost is, because of the 2 therapists and therapist time and so on. So it really just depends. I mean, there are some patients who will go into remission after 1 treatment of medicine. So I said $8,000 to $25,000 is the cost that we are charging at our clinic. And that's sort of a benchmark sort of cost. I imagine that's a bit similar to your your costs, Steve?
Yeah, look, I don't charge as much because I don't have a big business overhead. It's just myself, and we've managed to keep the cost down because of that. But that's because I'm not large scale. If I was large scale, I would need more back of the office support and the cost would go up.
Yeah. And a question here from Ada. Recent psychology, applying to do your master in clinical psychology. Definitely, Ada, you should do the certificate in psychedelic-assisted therapies, because then you will also get to meet some of the leading researchers who are on our faculty. And any other career advice related, well, by all means, reach out to us, any of you. We're very friendly and approachable, and we'll do anything we can to help you, add this as an adjunct or make this your career, whatever it is that you really want to do, because you're only on here because you care about helping your patients. I'm sure that's why. So any ways that we can help you to do that successfully, we will do. So Ada, please reach out, and anyone else. Other questions? We'll have
And this
one
is
last
about the
question.
patient referral pathway, which is important to understand, Tania.
Oh, okay, sure, Alan. What were you going to say? Sorry, Alan?
So it's important to understand that only an authorized prescriber psychiatrist can prescribe the therapies. At the moment, they are only allowed for PTSD, and MDMA is used to treat that, and psilocybin is used to treat treatment-resistant depression. So any patient who has that diagnosis can have the therapy as long as it's endorsed by a psychiatrist who is an authorized prescriber for these medicines. And yes, a patient will need a GP referral to go see somebody like Steve on the call.
Yes, but quite often, and Steve is exceptional in this respect, but a lot of the psychiatrists are the prescribers, but they're not necessarily sitting with the patients, which is
That's
why
right.
all of the other clinicians are so important, because they're the ones actually sitting with the patients, going through the therapy, holding the safe container for that patient and integrating the patient. So that's why we literally need thousands of therapists around Australia who are trained in this field, because the demand is so enormous. Any other questions before we finish up? No, all silent.
What about, sorry, one last question, if that's okay.
Sure, Jonathan.
I just wanted to ask if, is it contraindicated on people that have had sort of a psychotic experience, like a brief psychotic episode?
Can I answer that? Hi, Jonathan.
Hey.
Listen, I think the entire South Island is going to be full of authorised psychiatrists soon. We've got so many New Zealanders on our training. They won't be able to resist you. No, this is where in a clinical trial, if you've had a psychosis in the past, no matter how distant, you're excluded. But in the real world, you use your clinical acumen. So if someone used methamphetamine a year ago and had a paranoid psychosis for 1 or 2 days and then recovered, got off drugs, did a lot of therapy, and they were basically intact otherwise, then they are not excluded. Then you could treat them. So you
Amazing.
use your clinical expertise in that middle ground, yeah?
Great, thank you.
All right.
Could I just add to that? Sorry. I think it's really strategic, and then knowing the history of what's gone on, it's really strategic for us to work with more of the average kind of people to get points on the board, to build up the credibility of what it's doing before we take on the harder cases. And also during that time, we can build up a whole lot of skill sets, assessment sets to help us determine who's good. But in the immediate time, I think we need to work on the easier ones, so that, because the bad press can really scuttle this whole thing, and it doesn't take much. They can really beat up one failure, one crazy person who does something really crazy can really scuttle a whole lot of things. I think we really need to keep that in mind.
Yeah.
Yeah.
Great.
Don't be a hero.
Okay, well, if there's not any other questions, I think we will wind this up. But what we will promised to do is send you a copy of the presentation. We'll send you the special offer for the training, and we would ask you that if you know other clinicians who would be interested in this field and who would like to study in the certificate in psychedelic-assisted therapies, or who just want to learn more about this rapidly emerging field, to please reach out to Mind Medicine Australia, and please feel free to share what we share with you as widely as you like. All of our information is in the public domain. We have a wonderful website with loads and loads of information which you can learn. When I first got involved in this field, I read every single article, book, watched every video, and I still do, but it was like really getting up the learning curve and just learning about this field, doing your 10,000 hours or whatever it happens to be, that, you know, that gives you the confidence to really know what you're doing and talking about this to other people. Because at the end of the day, we're all just here because this is, I think, personal for each of us. We all know people who are suffering so enormously. So thank you to all of you for being so caring and doing the work that you do. It's wonderful, and we just are here to support you in any way we can. And thank you to you, Stephen, for being such a, not a hero in that other sense you mentioned, but definitely. And thank you to you, Sydney, and Ilan and Nicole for setting this up. And yeah, please reach out to us and stay in touch. And we look forward to meeting you all very soon.